Hi, my name's Coral. I'm going to be teaching you how to use Menopur. This is a multi-dose injection. I'm going to be teaching you Menopur 1200, but you may also have a box of 600. When you open the box, you will find a powder in a vial here, 2 syringes of liquid and a needle. If you're doing the 600 box, there will only be 1 syringe of liquid. We'll need to take the cap off everything, and it is good to pre-prep this. So I will remove the white cap by flicking this off with my nails. Remove the back of the syringe by twisting the paper and removing the cap. Take your first syringe of liquid and remove the rubber bung and put the needle onto the syringe. It is good to have the second syringe ready with the cap loosened, and you can have this resting as long as the end of the syringe does not touch anything dirty or any work surfaces. If you take the safety cap off the needle off by just pulling it away, go into the centre of the rubber bung and inject all the liquid into the powder. Once all the liquid has been injected, you will keep hold of the needle and twist off the first syringe. You will then take your second syringe, put it on and inject the second lot of liquid. Once that is all injected, you will remove this and discard of the needle. This is your medication all mixed together. This is Menopur 1200 units, and this is the medication that you'll be using for multiple days. Within the box, you will find a second box which has the injecting needles in, and you will need to use a new needle every time you do the injection. If you take the syringe and open it, if you remove the safety cap, and you will put the needle straight through the rubber bung. This needle is very small and ready for injection, so you will need to turn it upside down to fill the syringe. You will need to pull back and let the syringe fill with the liquid up to your dosage, and there are different numbers on the side, so please check your treatment plan. Once you're at the correct dosage, you will just remove this, and this medication will be used the next time. Any small air bubbles are fine in the syringe, but you can check for any air and push up, ensuring that your liquid is still the correct dosage. To do the injection, you are going to do it into your tummy. You will need to go below your belly button and in this area. So if you pinch the skin, have the needle facing you and go straight in. The needle will go in the whole way, and you will press on the back of the syringe, injecting all of the medication. Once this is done, keep it in the skin for a few seconds, count to 5 and take it out. The injection is now done, and this will be discarded off in your sharps bin. You will need to keep this medication safe now for use the next day with a new needle from here. Some tips for the medication. When the medication is unmixed, it needs to be stored in the fridge. When the medication is mixed together, this now can be out of the fridge but below 25 degrees. Another tip for the injection site is you may wish to use a little bit of ice on the skin before doing the injection to help with numbness.